Bougie or stylet? That's a question that's been asked by countless airway assistants in the emergency intubation setting. We'll look at the recently released Bougie Trial on this episode of Osler Short Cuts. The use of a bougie as a primary tool for intubation has been well described. However, its place in emergency intubation still remains a matter of debate. The Bougie Trial set out to determine if the primary use of a bougie in the emergency setting was superior to the use of a stylet. They included 1,002 patients and they were randomised across these two strategies in 8 ICUs and 7 emergency departments in 11 US hospitals. The primary endpoint was first pass success rate, which is a surrogate outcome that's been associated with complications in intubation and has been used in many similar trials. For the most part, these intubations were performed by senior residents using video laryngoscopy, and over 91% of patients were reported to have a grade 1 or 2 view. Importantly, while the trial participants all received face-to-face and online training, only one centre had previous experience with bougie intubation prior to this study. The primary outcome was not statistically different between the two groups, nor was the rate of complications, while the time to intubation took 12 seconds longer in the bougie group. Overall, it seems that in relatively straightforward intubations performed by inexperienced operators, bougie intubation is no better than using a stylet for first pass success. There are some important caveats, however. Most importantly, of course, the primary outcome is a surrogate marker. It does not necessarily follow that patient-centred outcomes will improve. As always, trial results depend on the patients who are included. Patients who were deemed to require immediate intubation were excluded, as were those who required a hyperangulated blade or had a specific indication for one or other technique. In total, only 89 patients had a Cormack-Lehane score of 3 or worse. Finally, the experience of the intubator may play a key role. Unlike the BEAM trial, which showed a significantly higher rate of first pass success with a bougie, most of the operators were inexperienced with the bougie technique. These issues notwithstanding, bougie is an extremely well-run trial, especially considering the study was unfunded. Yes, that's right, unfunded. The entire study team deserve a huge congratulations for bringing this important information to life. Overall, this trial suggests that in patients where clinicians do not believe it matters which technique is used, guess what? It doesn't matter which technique is used. If you want to learn more about the Bougie trial or the process of intubation using a bougie, head over to the My Osler app. It's completely free and you can access hundreds of podcasts, modules, journal reviews, quizzes, videos and articles there. See you next time on Osler Short Cuts.